Hey, thanks for joining me for this video. This is fatigue, the top 5 causes and what to do about it. Okay, here's the disclaimer. Fatigue is such a common symptom that it becomes a nebulous topic, and it's actually hard to organize thoughts about a symptom like fatigue in a way that makes it easy to understand. As an internal medicine doc, I like to prepare a brain map of an issue so that I have a way of thinking about it. And that's what I've tried to do in this video, but again, it is quite complex. So I hope that this information is helpful for you to start to build that for yourself. But again, this is such a complex topic that nothing that I say in this video should be taken as medical advice. If you are feeling fatigued, you need to go talk to your healthcare provider about that. And hopefully with them, you can work through this in a way that helps you arrive at the cause of your fatigue, as well as some things that you might want to do to try to help with the fatigue that you have. Fatigue is perhaps the most common symptom that people in the general population will describe. It's estimated that about 10% of otherwise generally healthy people will describe fatigue at any given time. In primary care practices, family doctors, that sort of thing, about 20% of presentations to the doctor are related to this symptom of fatigue. In some surveys, when they've asked adolescents, how tired are you? 30 to 40% of adolescents describe being fatigued at least 4 days a week. That's incredible. One of the challenges for this topic is that the physiology of what actually makes us feel fatigued is really undefined at present. A third of cases of fatigue never get a diagnosis. When you're talking about fatigue, the words that you use matter. So sleepiness is not fatigue. Sleepiness will get better if you go for a run or if you get a good night's sleep, whereas fatigue actually gets worse generally with physical activity, and it doesn't tend to respond to sleep. Okay, that brings us to the number 5 cause of fatigue in descending order. Number 5 is what I'm going to call primary fatigue. It is your body doing the right thing. If you like, your body trying to tell you something. Now, interestingly, the very first reference in the scientific or medical literature, if you like, to fatigue is about primary fatigue. So this is the very first reference that I could find in the medical literature. This is a paper written by Arthur Thompson, who was the assistant surgeon with the 14th Light Infantry. And he describes in this paper the concept that at the time, many people thought that a seasoned veteran was better able to function in the setting of war, and that a well-seasoned individual might survive better in a combat type situation. And he wanted to put this to the test because he realized that being well-seasoned basically meant that you were fatigued. And so he put this to the test. He had some data that he looked at. He had a group of new recruits who were not seasoned and therefore not fatigued. He had another group of individuals who had been involved in fighting who were seasoned veterans who were therefore more fatigued. And what he pointed out in this interesting paper was that in those who were fatigued, who were veterans, there was 1 death for every 19 individuals, whereas in those who were new recruits who were not fatigued, there was only 1 death in every 33 soldiers treated. So this is the first examination of this concept of physiologic, or what I'm going to call primary fatigue. If you are feeling this kind of fatigue, you need to take stock of some basic aspects of your life. So I'm going to propose a number of questions that you need to be asking yourself if you think this is the kind of fatigue that you're experiencing. The first is, are you getting sufficient amounts of sleep? The average adult requires 7 to 9 hours of sleep to be at their best, to not be fatigued. In adolescents and children, it can run up as high as 12 hours. And so many of the reason that 40% of adolescents report being fatigued is that for the most part, they are not getting adequate amounts of sleep. Once you get older, there is somewhat of a decrease in the amount of sleep that you need, but most elderly individuals probably still need about 7 hours of sleep a night in order to be at their best. The other consideration when you are considering sleep quality is, do you have obstructive sleep apnea? So obstructive sleep apnea is a very common condition in North America that affects a large swath of the population. And if you have obstructive sleep apnea, you may be getting what seems to be an adequate amount of sleep, 7 to 9 hours, yet that sleep may not be restorative. And so you may still be experiencing some primary fatigue related to poor sleep. The second question that you need to ask yourself if you may be experiencing primary fatigue is, how many hours per week are you working? There is a good reason that most unions have negotiated a maximum of 48 hours per work week. There are scientific studies that have shown a measurable increase in the risk of stroke if workers are working more than 48 hours per week. And certainly there is evidence that heart disease risk starts to increase in workers who are working more than 55 hours per week compared to those working 40 hours or less. So one of the reasons for you to be experiencing primary fatigue is that you are working too many hours per week. Another little test that you could ask yourself is, am I using caffeine to get through my work days? Another question that often relates to patients experiencing primary fatigue is, are you using alcohol at the end of the day to turn off after a busy work day? If you're answering yes to these questions, then you may be experiencing primary fatigue. The next question to ask yourself if you are experiencing primary fatigue is, do you get some good quality exercise most days of the week? You don't have to dress up in spandex, but if you want to stave off primary fatigue, you should be trying to get at least 30 minutes cumulative moderate intensity exercise at least 5 days a week, if not more often than that. The final question I would put to you if you are experiencing primary fatigue is, do you eat garbage? Learning to cook and learning to eat is a lifetime affair. And I think many people that are experiencing primary fatigue have forgotten that you need to really attend to the issues of how you eat and what you eat. There is so much good information available now that really no one has an excuse to be eating garbage. For those of you who eat fast food, if someone else is cooking your food, the fact that the health inspector checked the fridge a couple of months ago for mold doesn't mean that that food has real value. We need to demand a higher standard for our restaurants, and unfortunately, we have to be willing to pay for higher quality food if we are not going to make the food for ourselves. But these are all things that will affect primary fatigue. So, what is the treatment for primary fatigue? Well, the treatment is at least a 2-week holiday. So in order to recover from primary fatigue, you need about 14 days of good quality, stress-free rest. So if you like, I am going to give you this prescription, and you can take it to your travel agent. and hopefully your health plan will pay for this. I've heard that there are some Northern European countries where there is coverage for taking a holiday. And really, taking a holiday is a great way of managing primary fatigue and restoring your energy levels so that you can function again. All right, this brings us to number 4. I'm going to call this psychological fatigue. So, and whereas physiologic fatigue or primary fatigue is your body doing the right thing and trying to tell you something, psychological fatigue is your brain trying to do the right thing. Your brain is trying to tell you something. It is often challenging to distinguish between physical versus mental fatigue. Often patients describing fatigue will describe, changes in muscle performance, whereas people who are describing psychological or mental fatigue may describe changes in cognitive functioning. There is a very interesting 14-item fatigue scale that distinguishes between physical symptoms of fatigue versus mental symptoms of fatigue. So I'd like you to take this survey with me. So on the physical domains, do you have problems with tiredness? Do you need to rest more? Do you feel sleepy or drowsy? Do you have problems starting things? Do you start things without difficulty but get weak as you go on? Are you lacking in energy? Do you have less strength in your muscles? Do you feel weak? On the mental side, do you have difficulty concentrating? Do you have problems thinking clearly? Do you make slips of the tongue when speaking? Do you find it more difficult to find the correct word? How is your memory? Have you lost interest in the things that you used to do? So, if you're answering yes more to the mental questions than the physical questions, then you may be experiencing psychological fatigue. Now, I'm not a psychiatrist or a psychologist, but I would say that in general, mental fatigue or psychological fatigue is more challenging to manage than physical or physiological fatigue. There has been some success with treatment options, including cognitive behavioral therapy, graded exercise therapy, and then some serotonin reuptake inhibitor antidepressants have also been shown to help in some cases of mental or psychological fatigue. Okay, let's take a step back and look at when I'm assessing a patient with fatigue in the clinic, how do I approach the issue? The first thing I ask myself is, does this person work harder than I do? If they do, then they probably have physiological fatigue and they probably need a holiday. If the answer to that is no, then the next question to ask is, does the patient endorse depression or anxiety as a major issue? If the answer to that is yes, then this is where I'm thinking about psychological fatigue, and I'm going to consider cognitive behavioral therapy with or without the addition of an SSRI type of medication. In addition to that, at this point, you really need to conduct a thorough medical examination for fatigue. This brings us to number 3, pathological fatigue. This is sometimes called secondary fatigue. This is your body trying to tell you that there's something significantly wrong internally. Now, one of the considerations with pathological fatigue is that in general, this is related to a definable medical condition, and it lasts longer than the wait time for your appointment, which is generally somewhere between 1 to 6 months. This is the bread and butter of what internists do best. We love this stuff. And roughly, in order of importance, the types of diseases that we will be able to identify in a patient describing pathological fatigue are infections like Epstein-Barr virus that causes mono, drugs or substances that affect brain activity. So, for example, opioid analgesics. These drugs or substances can be either prescribed or they could be recreational use. Autoimmune diseases like rheumatoid arthritis are common. Major organ diseases like bone marrow issues with anemia, heart failure, lung problems like chronic obstructive pulmonary disease, kidney impairment, liver impairment, etc. Cancer then falls into this issue of pathological fatigue. And then I would say drugs that don't have definable brain activity, like your blood pressure medications, can still be associated with some element of fatigue, for example, beta blockers. And then on the list of pathological fatigue is low thyroid hormone levels, low sex hormone levels, and then low adrenal hormones. And so this is kind of the summary of what can cause pathological fatigue. Okay, for the doctors in the crowd, this is a suggestion for a workup for fatigue. And again, the scenario will vary. You need to use your professional discretion in terms of what you actually do. I would suggest that the first thing you should do is understand whether the patient is exhibiting symptoms of depression or anxiety, and consider cognitive screening if it's appropriate. You then need to conduct a thorough history and physical examination, which will then guide the testing that you actually do. A part of your history is to get a very accurate medication history and also a very accurate substance use history, because these may be the cause of the fatigue. You need to ensure that the patient has received appropriate cancer screening given the scenario. I would suggest, in terms of blood and urine testing, that all patients deserve to have a hemoglobin and an MCV to check for iron deficiency. All patients deserve some test of inflammation, either an ESR or a CRP. I think all patients deserve to have lights, calcium, albumin, glucose, hemoglobin A1C levels. All patients should have kidney testing with a serum creatinine, urine RNM, liver enzymes, liver function tests. And then depending on the history and physical findings, you need to test for infection, whatever you like. As an aside, you may want to avoid testing for mold or Lyme, but that's another video. Patients should be considered for a chest x-ray, echocardiogram, pulmonary function tests. All patients presenting with fatigue as the primary complaint should have a TSH, and you should seriously consider a cortisol level and postural vital signs to make sure that the patient isn't adrenally insufficient. And then finally, you may decide to do some antibody testing, whether that's ANA, double-stranded DNA, rheumatoid factor, anti-CCP antibodies, TTG, IgA, that sort of thing. And obviously, the physical findings will guide you in terms of what antibodies you may or may not test for, but this would be a partial list. Okay, this brings us to the number 2 cause of fatigue, and it actually brings us to the number 1 cause of fatigue as well, because I've grouped these two things together. And that is chronic fatigue syndrome, or what is also called myalgic encephalomyelitis, and more recently has been called systemic exertional intolerance syndrome. So I view all of these things as a syndrome, and they are referring, I think, to different aspects of the same disease process. But typically, before you can be described as having fatigue from this, you need to be unwell for at least 6 months. And you need to have been through the workup for fatigue that I've already outlined. So you need to have been on a 2-week holiday without any improvement in your fatigue. You need to have managed any psychological causes of fatigue in terms of anxiety, depression, that sort of thing. You need to have embarked on a thorough workup for pathologic causes of fatigue. And all of this testing needs to be normal in order to be described as having this condition, which I'm going to call myalgic encephalomyelitis. All of the patients that I have met who have myalgic encephalomyelitis have a very characteristic description of their symptoms. And I've come up with a mnemonic, which I hope you enjoy. But the symptoms or characteristics of this condition, as far as I have seen in my patients, are that they often have some element of pain. They all have a reduction in their ability to function in their everyday life for at least 6 months. They most always describe orthostatic intolerance. Now, that's not necessarily orthostatic hypotension, so that when they stand up, their blood pressure drops, but certainly they don't feel well when they have to be upright, and if they lie down, they feel better. They all describe an element of brain fog. They all describe exertional malaise, or just, doing things doesn't make them feel well. In all the cases that I have seen, there's a fairly sudden onset to the myalgic encephalomyelitis. And there's often a prodrome, which sounds very much like an infection, like Epstein-Barr virus, for example, without obviously testing showing that that's what they have. And then the other characteristics of this condition is, even without things like sleep apnea, their sleep is non-restorative. They can sleep for long, long hours and still feel extremely fatigued. So this is really a description of the constellation of symptoms that the patients will describe. And if you are saying yes to these symptoms, then you may well have myalgic encephalomyelitis. The first thing I would say, if you think you or your patient is experiencing this condition, is be careful where you get your information. I would recommend that you go to reputable internet resources for patients with myalgic encephalomyelitis. The two that I would recommend off the top are the CDC, and Mayo Clinic also has a good set of information for patients. I will include the links to these in the information below the video. There are all kinds of people that will try to sell you snake oil to try to help with the fatigue in this condition. And I would encourage, if you think that you have this condition, to view most of this as snake oil. On the next screen, I'm going to show you the treatments that have evidence for managing the fatigue associated with myalgic encephalomyelitis. You can see that the screen is blank, and that is because as of 2021, there are no treatments that are well recognized as being evidence-based for managing the fatigue in this condition, or for dealing with the underlying pathophysiology of myalgic encephalomyelitis. There are none. The only thing that has been shown to be helpful for patients who are experiencing fatigue related to this condition are that they need to focus on energy management and physical maintenance. They need to pace themselves, but there is nothing that is going to improve the underlying fatigue that we have been able to find scientifically thus far. So certainly unstructured exercise does nothing to help with the underlying condition, and even structured or graded exercise programs, even done by experts in this condition, have not been shown in good quality research studies to actually deal with the underlying problem of fatigue in this condition. There are no dietary or nutritional supplements that have been shown to improve the underlying fatigue in this condition. There is no evidence that CBT or SSRIs will deal with the underlying fatigue in myalgic encephalomyelitis. And there's really no evidence for any medicines or supplements or homeopathic remedies or acupuncture or anything to deal with the underlying fatigue caused by myalgic encephalomyelitis. That is not to say that if you have this condition, you shouldn't do what you can to improve fatigue related to physiologic conditions. So, make sure you get enough holiday time to deal with the psychological causes of fatigue. And certainly for many patients who are suffering from fatigue related to myalgic encephalomyelitis, it's actually important to be involved with a counselor or therapist. But that's not to deal with the fatigue related to this condition. That is to deal with the other aspects of illness and perhaps some of the psychological consequences of your inability to function. So I'm not saying that you shouldn't be with a therapist, and I'm not saying you shouldn't take an antidepressant, but what I'm saying is if you're doing that, you're doing it for other reasons, not because you believe it's going to help you with the fatigue related to myalgic encephalomyelitis. If you have other issues going on, other causes of pathological fatigue, obviously you need those conditions treated. If you're on medications that are contributing to your fatigue, you need to consider getting off of them. If you have underlying heart disease or, lung disease, you need to deal with those things. You need to do what you can to clean up your life in terms of the way you live, the diseases that you have. But none of those things are going to deal with the underlying fatigue related to myalgic encephalomyelitis. And I think it's important for you to recognize that as you move forward. That isn't to say that we won't have a better understanding of the etiology, the reason for this condition, or that we won't come up with good treatments in the future. But right now, as of 2021, we really don't have anything to offer in terms of dealing with the underlying fatigue related to this condition, other than suggesting that you be very careful in the way you expend your energy on a day-to-day basis. Finally, I want to leave you with a list of references. I did rely on a number of important references as I was preparing this video, and I will leave these references in the links below. Finally, I hope you have enjoyed this video. If you did enjoy it, please like it. Please subscribe to the channel, and if you want to be notified of future releases, please ring the bell. If you know a patient or colleague that are suffering from fatigue and you think this video would be helpful, please share it with them. And with that, I hope you have a wonderful fatigue-free day, and I look forward to our next time to meet. Thanks so much for watching.